of the anatomy, mostly for the facial expressions, so the benign essential blepharospasm portion, but this also goes along with hemifacial spasm and Mejo's syndrome. So this will review those muscles, what we're treating, and I'll talk a little bit about treatment and how your doctors will treat. I can hear from some of the questions this morning that everyone always wonders, and knowing that I've been treating patients for 19 years with blepharospasm, hemifacial spasm, orofacial dyskinesias. And the question always is, when will this go away? And unfortunately, you've heard that answer is not really. It is something that gets treated every 2 to 7 months on average with Botox as the preferred treatment. Oftentimes I'll start with some medical treatment for patients who aren't quite ready or want to think about the different side effects they're going to get from Botox. But those medications are not as effective. So we've heard of some carbidopa, cyclobenzaprine, muscle relaxants, anxiety medicines, benzodiazepines like you have Klonopin, lorazepam, things of that sort, and those can be helpful because we've also heard this morning that this has some relation to a mental state. We've also heard that there can be depression with this disorder and anxiety, and that is very common and something that many of my patients share. And it affects how your eyes function. As you're more anxious, or as you're more depressed, or as you're not in control of your thoughts, it seems to be worse. And that can lead to people noticing it more, which then adds to distress. And so these are the things that you develop a relationship with your provider. And that's one of the reasons why we say you don't necessarily want to jump to multiple providers, but you want to develop that relationship. So I have patients I've been seeing for 19 years. We know I won't change their treatment after one time when they tell me they're having issues, it doesn't work well, it didn't work well this time. And I was like, well, what's happened? Stories I heard from my treatment sessions this week were, well, my brother died. My husband passed away. My cat is in the hospital, or it was hospitalized and needed surgery. Not only were there emotional distresses, but then financial distress. So all of these things, absolutely, I feel feed into it, and that's something that you develop and work with your provider to understand how they can help you. So I do prescribe medications for my patients. We do also sometimes provide antidepressant medications. Now, I'm an ophthalmologist, and when things evolve past that point, I will refer to my neurology colleagues because some of the medications I'm not as comfortable prescribing. But again, that's a discussion to have with your doctors and to understand that relationship. So hopefully you'll continue to understand that relationship, that how it pertains to you, your friends who have this, or other people who you might need to have this, and make that open discussion with your physicians. So as the eye doctor, of course, I want to focus on the eyes first. And we notice the muscle that closes the eye is the orbicularis oculi. And it is this round muscle, fibers, that close the eyes. It also is responsible for blinking. It lowers the lateral aspect of the eyebrow. So we'll see pictures of this in action. And it's immediately below the skin surface. There's really nothing between you and the muscle once you put a little needle through the skin. It is split up into considered to be split up into two segments. There's the preseptal segment, and that tends to be the broader fibers that are on the outskirts. And the little X's that you see here are often the sites where I will inject, or some doctors will inject. If you were to look at these muscle fibers They tend to be a little bit more fatty. They're not as dense as the next set of fibers. And they are closer to the muscle that lifts the eyelid up. The muscle that lifts the eyelid up is just behind that muscle, and that's why some of you may have noticed that every now and then you get an injection and your eyelid actually droops worse. It's not spasming anymore, but it's actually droopy where it's hard to open. And that's because, as you've heard today, the medicine spreads. It can spread approximately 2 centimeters. That does depend on where it's injected, so that differs in looser tissue and denser tissue. But it does spread, and it can spread to affect muscles that are not intended to be affected. So side effects can be a droopy upper eyelid or a droopy lower eyelid, eye irritation, tearing, watering of the eye, or sort of a drippy, watery feeling eye. And of course, you're getting an injection, so you might get a bruise. These things typically recover. Most patients, I advise them that within about 2 to 4 weeks of treatment, it usually gets better. And I advise all my patients that they want to keep in mind that they may need to use artificial tears more frequently in that first month after treatment, because they do tend to have more dryness, which adds to the irritation and scratchiness of the eye. The pretarsal muscle fibers are the ones that are pretty much just above the eyelashes and just below the eyelashes. These muscle fibers are favored in doing injections. Now, excuse me for the neurologists who are in the room, but in my experience, the neurologists do not want to treat this close to the eye, and that's usually the ophthalmologist. So I sometimes see patients who come to me after being treated by a neurologist, and they say, oh, these are completely different locations from where they were injecting before, because they will keep the needle away from the eye. So if you look at these muscle fibers, they are more dense. They have more skeletal muscle than fat. The neurons, or the nerve endings that actually innervate the muscle fibers, are a higher concentration of them than in the preseptal portion. They also tend to be this type 2 muscle fibers, which are the fast twitch muscle fibers, providing bigger and more forceful forces. So they're thought to actually have more effect on blepharospasm and eyelid spasms than the preseptal ones. So it's considered, that's why these are favored, and many studies have shown that you can use a lower dose of Botox in this location. It also tends to cause less diffusion because of the dense fibers. It doesn't diffuse as far, so they've found less ptosis. And because they're denser fibers and nerve endings, it actually can be more effective, which is why you have the lower doses. The one adverse side effect to this location is that it is more prone to having a bruise, because there's also more blood vessels concentrated in that area. So, I guess you can't hear me talking to my patient here, sorry. So here's a patient, and you can just see this is much milder than the photos that Dr. Hyatt, or the videos that Dr. Hyatt was showing. But you can see the muscle fibers twitching with quivering of the eyelids and then occasional closure. This patient has a milder hemifacial spasm, requires about 12 units of Botox. When we're looking at what this function does, as we mentioned, here's the natural resting state. Here on closing, you can see the wrinkles that form from the compression of those muscle fibers. And this is where Botox is very popular. Botulinum toxin injections are very popular for cosmetic patients because they want to get rid of these crow's feet. They can get rid of the bunching that happens on what's normally smooth skin when you squeeze, smile, or close your eyes. And you can also see a bit of that eyebrow. This eyebrow flattens, comes down, particularly in the lateral aspect, and loses some of the arching. And that's the typical function, normal function of blinking. Here, again, are those X's. This would be some typical spots to treat. Again, pretarsal in the lower eyelid and the upper eyelid. We do tend to avoid the central portion of the lower eyelid. Injections in the central portion of the lower eyelid can cause a little bit more of a bag to form in that lower eyelid, just due to the sagging of the muscle. And then the crow's feet area. So this is where these injections help lift the eyebrow up, open the eyes brighter, and treat the fibers that are spasming. The corrugator supercilii muscle is a muscle of the forehead that runs across and is responsible for drawing the eyebrow down and in. It produces the vertical wrinkles, the 11s, as some people call them. It's covered by a thicker skin and subcutaneous tissue. So this is also an injection that's going to go deeper than your average injection, and that can be a bit more painful as well. Not to mention nerves that give you feeling to the forehead run in this area, so it does tend to be a more sensitive spot. Patients often wonder why cosmetic patients do this to themselves if they don't have to, but it is brief and it does pass, thankfully. Here's those wrinkles at rest, nice and smooth, with concentration. Here are those vertical lines, those 11s, that form when this muscle squeezes the skin together. You'll also notice, I want to point out in many of these pictures, whenever we create these functions, watch what's happening to the eyes. They close. They squint. This is not trying to close the eye. This is just the action of that muscle. So that's why sometimes we have to treat more than just the eyelids in blepharospasm. We might treat the forehead as well as the cheeks. And here are some typical injection sites in the forehead that we would treat above the, the eyebrow line. But this can also treat some of the ciliaris fibers that come up into the forehead. Thankfully, insurance companies haven't restricted me from doing that here in Missouri. Procerus muscle. This is a muscle that's in the middle above the nose. So it does also pull down the skin between the eyebrows. It produces horizontal wrinkles over the bridge of the nose, also covered by thicker skin and subcutaneous tissue. So here is an example of what can be smooth, and here my model was basically also squeezing the eyes shut, but you can see those vertical lines. These vertical lines also can become permanent over time as gravity does its work and causes the forehead to drop. But you can also here, again, see those 11s coming across that inner aspect of the eyebrow. And then this, again, is responsible for the procerus. The injection for this muscle, I often will do right here in the middle at the bulk of the muscle. There's that X. The zygomaticus major muscle is the muscle responsible for us smiling, and it can also create the dimples at the corners of the mouth. It is covered by the skin and the cheek fat, so even deeper than the forehead muscle, and also sometimes more painful. However, it's away from the nerves, which means that it can sometimes be, it's hit or miss sometimes. It's a matter of luck whether or not you feel that pinch. With smiling, you can see how it dimples the skin, creates sort of the nasojugal fold, and again, eyes tend to close as that cheek rides up. Now, these are the typical wrinkle lines that happen over time with smiling. My injection point here typically is about 2/3 of the way up from the corner of the mouth to the apple of the cheek or the cheekbone of the zygoma. I don't want to treat too close to the mouth because then that causes a frown appearance. The corner of the mouth can droop. Some patients with hemifacial spasm already have that even without Botox. It's the worst of both worlds. You're treating the muscle that overacts and draws the cheek up, and yet it doesn't work normally when it's relaxed either. That those things are very common with spasms. All right, here we see my patient again. You can see some twitching at the corner of the mouth, and here you can see just that it draws up that corner of the mouth. So his injections are right about here, and they can control that well. And again, you can just see how it affects the eyes. You can imagine as this comes up, the eye closes as well. Levator labii superioris aliqui nasi muscle. No one's ever going to test you on that. Okay. But it is the longest named muscle in the entire body, and it corresponds to this little muscle on the side of the nose. It lifts the upper lip. It flares and dilates the nostril. It's underneath the skin, transitioning between the nose and the cheek. So it's relatively superficial. And it's also very close to a large artery. So sometimes you can get bruises here, and you can also, it is a sensitive spot. And this is what that looks like. This can be treated with Botox to help, because some people will feel their nose ride up as well as their face scrunch up. And again, she's not trying to close her eyes, but the eyes naturally close. All of this activates that eye closing. And we see what oftentimes people call bunny lines. This is that muscle wrinkling up. And the injection point would be sort of here. It's at the base of the median muscle, right about here, on the side of the nose. The orbicularis oris muscle closes the mouth, puckers the lips. It's needed for sucking on a straw or whistling, and it's also close to the surface. I typically do not inject this for blepharospasm patients, but it is something that occasionally could be needed for facial dyskinesia. And this is puckering of the mouth is not possible without this muscle, and it creates those vertical lines around the lips. Treatment of this can help reduce that, but just be aware that while you might not purse your lips very often, it is needed for drinking out of a bottle, sucking on a straw, and sometimes with other facial injections, I've warned patients injections around the mouth can lead to drooling. And that's a no-no. And you have to tell your doctor if it happens, okay? Because then they can adjust their treatments. And again, these injections are very sensitive, I find. Much more sensitive than around the eyelids. The depressor anguli oris muscle draws down the corner of the mouth. It is deep to the skin and the fat of the cheek. Now it's this muscle down here. And that's where we'll draw and frown, causing a grimace appearance. So we see the little lines that form out here, almost inferior dimples. You see sort of the deepening of the mentalis line, and it's what just causes people to have that downward corners of the mouth. I will often treat this muscle in part because when we treat the zygomaticus major, that can cause a downturn of the mouth. And by treating a little bit underneath, the injection actually I do goes underneath the chin, right at, essentially at the outer corner of the mouth. And I dive deep to the tissue. That can help keep the corners of the mouth level. But again, sometimes we just forego that injection because of drooling or difficulties eating and drinking. And then the last muscle I'll cover is the platysma muscle. So this is the muscle of the neck. This is a superficial muscle. There are a lot of muscles of the neck, as we were talking earlier with the person here. But this is a flat muscle that extends from basically the jawline down to the collarbone. And it can draw down the lower lip, angle of the mouth. It can also just be seen as neck bands with aging. So here is a neck, and I'll just draw your attention, it's fairly narrow. And then with depression and activation of a grimace, it widens, and the very classic bands show up right in this area here. And these can be treated with Botox as well, botulinum toxin treatment. Oftentimes, approximately a center, find the band, and I'll just run down it to help. Okay. Not sure if we have much time, but any questions for me?
Do artificial eye drops irritate around the eyes generally, or is that just my imagination?
The question is, do artificial tears or eye drops irritate around the eyes, or is that my imagination? They should not irritate your eyes. They should provide some relief for irritation of the eyes. However, I do find that some people are very sensitive to preservatives in the bottles. And if you find that you're irritated by the drops, I would recommend that you use preservative-free drops.
They cause the same problem.
If they still cause the same problem, then it may be that you just have the general irritated eyes that happen with blepharospasm, and which is also something that comes up even without the use of the tears or the dryness. And I will mention for preservative-free drops, they now do put them in bottles, so you just have to be careful that it'll say PF or preservative-free. So you could get preservative-free drops in a bottle and not have to use the little dropperettes.
Oh, just a quick question. What about injections like the tongue? If you're having movement of the tongue that's producing a lot of saliva, so which may contribute to issues. And this hyperfrontis is also having some issues with spasm, but the tongue.
So the question is, how about Botox injections to the tongue, especially for increased saliva production and movement of the tongue along with spasms? That is where my eye doctor training would put me at referring to my neurologist colleagues. So hopefully they'll answer that question for you later in the day. I don't venture into the mouth, just around it.